Imagine taking your blood thinner exactly as prescribed. Your INR has been stable for months. Your doctor is happy. Then, a friend recommends a natural herbal supplement. It came from a health store, no prescription, no warning labels, completely natural. 1 week later, you develop unexplained bruises. Your gums bleed when brushing your teeth. Your urine turns pink. Or even worse, you suffer a life-threatening brain bleed. How could a simple herbal supplement do this? Today, we're going beyond internet myths. We'll explore the invisible biochemical war happening inside your bloodstream and explain exactly why herbs like ginkgo biloba, garlic, ginger, and Saint John's wort can completely change the way blood thinners work. If you're a pharmacy student, medical student, healthcare professional, or you or someone you know takes anticoagulants, this is a video you should watch until the end. Why blood thinners are so sensitive. Let's begin with the basics. Many people believe blood thinners simply make blood thinner. That isn't actually true. Blood doesn't become watery. Instead, these medicines interfere with the body's clotting system. Think of blood clotting like an emergency repair team. Whenever a blood vessel is damaged, clotting proteins rush to the scene to stop bleeding. Blood thinners slow down this repair process. This helps prevent dangerous clots that can cause stroke, pulmonary embolism, deep vein thrombosis, heart valve complications. Common anticoagulants include Warfarin, Apixaban, Eliquis, Rivaroxaban, Xarelto, Dabigatran, Pradaxa. Each medicine works differently, but every one of them depends on a carefully balanced therapeutic window. Too little medicine, dangerous clots form. Too much medicine, bleeding becomes life-threatening. This is why even small changes inside your body can completely change treatment outcomes. The myth that natural means safe. One of the biggest misconceptions in medicine is this: if it's natural, it must be safe. Nature gives us wonderful medicines, but it also produces some of the world's strongest poisons. Digitalis, belladonna, ricin, all are natural. Natural does not automatically mean harmless. Herbal supplements contain biologically active chemicals. These chemicals enter your bloodstream, interact with enzymes, bind to receptors, alter platelets, and even change how your liver processes prescription medicines. Your body doesn't recognize whether a molecule came from a pharmacy or a plant. It only responds to chemistry. The additive effect, when herbs double the risk. Some herbs naturally reduce clot formation. When combined with prescription anticoagulants, their effects stack together. This is called the additive anticoagulant effect. Let's look at a few examples. Garlic. Garlic contains sulfur compounds that reduce platelet aggregation. Platelets become less able to stick together. Add Warfarin or Eliquis. Now you've reduced clotting through two different mechanisms. Bleeding risk increases. Ginger. Many people drink ginger tea every day. Large amounts of ginger can also reduce platelet activity. Combined with blood thinners, bleeding risk rises further. Ginkgo biloba, one of the most famous herbal interactions. Ginkgo can inhibit platelet activating factor. Several reports have linked ginkgo with spontaneous bleeding episodes, particularly when combined with anticoagulants. The invisible chemical war inside your liver. Now we reach one of the most important pharmacology concepts. Your liver is a giant chemical factory. Inside liver cells are enzymes called the Cytochrome P450 system. These enzymes metabolize many medicines, including Warfarin. Imagine a busy highway. Every drug wants to use the same lanes. When herbal supplements arrive, traffic changes. Some herbs block the highway. Others speed traffic up. Either situation becomes dangerous. St. John's wort, the hidden enemy. St. John's wort doesn't increase bleeding. Instead, it makes Warfarin and many other medicines disappear faster. How? It induces CYP3A4 enzymes and increases P-glycoprotein activity. The liver breaks medicines down more rapidly. Blood levels fall. The medicine becomes less effective. Now the patient thinks they're protected, but blood clot risk silently increases. This can result in stroke, pulmonary embolism, deep vein thrombosis, treatment failure. This is why St. John's wort interacts with hundreds of prescription medicines. The vitamin K paradox. Warfarin works by reducing vitamin K-dependent clotting factors. Vitamin K has the opposite effect. Foods rich in vitamin K include leafy green vegetables such as spinach, kale, broccoli. This doesn't mean patients should avoid vegetables. The key is consistency. Eating similar amounts each week allows Warfarin dosing to remain stable. The real danger comes from sudden changes, crash diets, green juice cleanses, or herbal products containing large and unpredictable amounts of vitamin K. Warning signs you should never ignore. Patients should seek urgent medical attention if they develop unexplained bruising, bleeding gums, frequent nosebleeds, blood in urine, black, tarry stools, vomiting blood, severe headaches, sudden weakness, confusion, difficulty speaking. These may indicate serious internal bleeding or bleeding in the brain. Why supplements are different from medicines. Prescription medicines undergo strict quality control. Each tablet contains a carefully measured dose. Many herbal supplements do not have the same level of standardization. Different manufacturers, different extraction methods, different growing conditions can all produce dramatically different concentrations of active compounds. Two bottles with the same label may not contain identical amounts of active ingredients. This unpredictability makes drug interactions even harder to anticipate. A simple safety checklist before taking any herbal supplement while using a blood thinner. Tell your doctor or pharmacist. Tell them about herbal teas. Tell them about vitamins. Tell them about traditional medicines. Never start or stop supplements without professional advice. Watch for bleeding signs. Attend scheduled INR monitoring if taking warfarin. Remember, your healthcare team can only protect you from interactions they know about. The biggest lesson today isn't that herbal supplements are dangerous. It's that biology is complex. Every plant contains chemicals. Every medicine contains chemicals. And inside your body, those chemicals are constantly interacting. Understanding those interactions doesn't just help you pass pharmacy exams. It helps protect real patients from preventable harm. If you found this explanation helpful, leave a like, subscribe to MedEducation, and share this video with someone taking blood thinners. It could genuinely help prevent a dangerous medication error.